First, I would like to say that my name is Peggy Mancuso. I teach at Texas Women's University. I am very grateful to Dr. Peggy Chen for giving me this opportunity to be able to talk about the model that I created on dynamic health informatics. And thank you for clicking on this particular thing so you could learn more about the model and my perceptions of the model. I'm going to show you here where the model is. This first occurred to me when I was working with people whose expertise was in computer science, and as they would talk about what was happening with technology and computers and health in today's world, they would talk about the human perception. And that's when it occurred to me that what's happening really when we talk about health informatics is that bridge between the human and the computer in order to promote health. There had been several models of health informatics, and still are, that are available. However, they did not seem to reflect what was happening in today's world. For one thing, we can't predict it. Healthcare information technology, as you can see at the bottom of the model, is a wave. It's coming, sometimes I think it's more like a typhoon than a wave. And what exactly, how the technology will progress and help us with promotion of health with our patients, sometimes it's hard to predict. Every day is a new day. So that's how I saw this technology wave coming. And I saw that the interface between the wave and what's happening with healthcare informatics went both ways, in as much as we contribute to that wave and that wave changes us as well. You'll notice here we have the bioinformatics component of the model, and the bioinformatics component of the model is made up of those things that have to do with molecules and atoms, or genes or genomic, our genetic interior and exterior universe, and that coincides somewhat with what we use to image or to visualize. And so we have another whole area of informatics that's made up when defining imaging. How we take what we visualize and turn it into pixels, into something that will help us make diagnoses, really and truly. The newest part of bioinformatics, and unacknowledged by several professionals, are those trackers that I have on and many of you may have on. Well, you can't see. I have a Fitbit and an Apple Watch currently, in which each of us is producing a lot of physiological data in our day-to-day lives that can be gathered to help us learn more about the human condition. I see bioinformatics as being parallel and supporting health informatics. The general center of health informatics is the consumer, and I think that is a change in as much as the consumer has often been forgotten. In my model, the consumer is somebody who is seeking health care, but who may or may not have a relationship with a healthcare provider. Once that person does have a relationship with a healthcare provider, then we label them as a patient. Although really and truly we're talking about the consumer patient because we come in and out of both roles. Consumers themselves are contributing again to the science and to the wave of health informatics. For example, with online communities such as Patients Like Me, in which you get groups of consumers who are doing their own research on their own diagnoses. The patient, therefore, then, is the center of the healthcare team. And even though informatics itself is the most interprofessional of disciplines, all healthcare disciplines use it, including veterinary medicine, the team itself and how the team cooperates hasn't been the center of informatics models. Interoperability, or the ability of systems to speak to one another, is. However, the ability of different team members to speak to each other and to understand and to have their languages and vocabularies be understood and respected by other team members has not been. Interoperability is more than between software and codes. It's between people. The patient then again becomes part of the community, and the community is the center of public health informatics. I think the change here is we've come to a culture in which we're trying to promote the health of communities instead of just tracking disease. And such as what's happening with Robert Woods Johnson right now. So we have all of these coming up to form health informatics that's supported by bioinformatics. You'll see at the top of this we have the research continuum, and I've kind of incorporated the way that computer scientists look at data, information, knowledge, and wisdom. And data to a database person is just one piece of information. It could be a number like 120. It isn't until you put that number within context that that number becomes information within. And if you say 120 over 80, then suddenly we understand that that number is systolic blood pressure. And so that's information. But that number 120 may also be somebody's heartbeat is too rapid, or it could be someone's weight. So it isn't until you take that number 120 and frame it that that number becomes information. Then, as you progress along that continuum that's supported by research, we develop knowledge, and we can say, well, is 120 over 80 a normal, good blood pressure? Or should I treat that blood pressure? The thing that I think is special about what nursing in particular has contributed to the data, information, knowledge continuum is wisdom. And that is the understanding sometimes that there are untoward effects of our technologies. And just because we can do something does not always mean we should do something, or that it's wise to incorporate a technology in a certain practice. In the early days of electronic health records, for example, in the ways we implemented them, sometimes we did not help situations, and there are instances in the literature in which mortality actually rose after electronic health record implementation. So my definition here at the top of the model comes from one of my mentors, Dr. Bill Hirsch, and he said that informatics is people plus information plus technologies. And it is. It's that particular interface. With this model, and I am the eternal optimist, I do believe that we are all going to be living in healthier worlds as a result of the technologies. And that's the one message that I want to leave with you. The reasons why humans create models is because it helps us understand. And working through this cognitive process helped me understand and classify various kinds of concepts that I encountered as I delved into the informatics world. Thank you very much for listening, and you feel free to email me at pmancuso@twu.edu with your comments and perhaps innovations that you might have of your own that you've encountered in the health informatics world. Good evening.